Hi and welcome to Synapse. This is Dr. Sonika, Senior Resident, Plastic and Reconstructive Surgery. Today I'm here to talk about MRCS exam, which was a highly requested video since a very long time. And I finished my MRCS and got the membership of Royal College of Edinburgh in July 2023. So I have been through the procedure myself. So I kind of know how it is done and what are the questions or FAQs that the students might face. So in today's video, I shall be addressing those FAQs. So without much delay, let's get started. So what does MRCS stand for? MRCS is Member of Royal College of Surgeons. It's a postgraduate diploma, following which a surgeon is allowed to be a member of any of the four Royal Colleges, namely the Royal College of Surgeons of Edinburgh, which is the oldest, and the Royal College of Surgeons of England, Royal College of Surgeons and Physicians of Glasgow, and Royal College of Surgeons of Ireland. The MRCS exam has now become an intercollegiate exam, both your Part A and Part B. So what is the intercollegiate pattern? We would get to know in the further course of the video, where I'll be highlighting it. So that is what is MRCS. So with that introduction, let us see what are the advantages of having MRCS. First thing is you become the member of Royal College of Surgeons, which is being the member of the top surgical society in the world. You get access to the newsletters, all the meetings, conferences, so you'll be updated and uh, you would be part of the top surgical society, as I just mentioned. And the second thing is, after Part B, clearing Part B, you can apply for the GMC registration. And for obtaining the GMC registration, you can apply for jobs in the NHS and start your UK journey. And the third thing is, the Middle East countries recognize the GMC registration. If you have GMC, you need not write the licensing exam separately. You can directly apply for jobs in the Middle East. So that's a plus point. And other countries also, like Australia and Singapore, also consider this MRCS to be a plus point on your CV. So that's also an added advantage. And there's some of you who say, I don't want to move to the country, I just want to stay in India. So for you guys also, it's a plus thing on your CV. If you're working in a corporate setup, so you would definitely ask for a better pay scale, and also a better position in the hospital. So these are the advantages of having MRCS. So with that, let me just go to the next important aspect, that is who is eligible to give this exam. Uh, Anybody with a basic medical degree, that is MBBS or any degree in any other country which is equivalent to MBBS degree, is eligible to give the MRCS exam. So that lets a lot of question come in intern's mind. That is, uh, interns usually think or uh, plan to give PLAB usually, but it's not a rigid rule that you have to do PLAB and then go to the UK and then after your core training do your MRCS. No, if you are pretty clear about taking up surgical branch in your career, then you can rather skip the PLAB pathway, go directly to into the MRCS pathway, finish Part A, Part B, do your IELTS or OET, apply for GMC, and directly go for a CT level job, okay, in the UK. So that way you just bypass the PLAB route altogether. The time that it takes to clear your PLAB exam, the time that it takes to do your FY2 again there and then apply for core training and then do your MRCS. So you will be bypassing that. So if you are an intern who is pretty much fixed about taking up surgical branch in your career as your career, then consider MRCS rather than going through the PLAB pathway. Okay, so this is food for thought. But if you are already a surgical resident, then uh, it's pretty clear. You just take up the exam and do it. So I guess I've made it very clear. It's just the MBBS degree that is important and essential criteria to give the exam. So if you have experience of working in surgery, like doing your masters in surgery, or someone who is doing their MCH or done their MCH, these are all desirable criteria. So all they ask for is your basic MBBS degree. So even an intern can give this exam. So with that, let me go into the uh, pattern of the exam itself. So the MRCS exam is conducted in two parts. There is part A and part B. So the part A is SAB type, that is single best answer type of paper, which is nothing but your MCQ pattern, where every question has five options and you choose the right answer. So the part A exam happens every 3 times. Okay, happens every 3 times in a year. So it is usually in the month of January, May, and September. So there'll be three exams in 1 year. So you can apply for this exam through any of the colleges. That is what I meant when I said intercollegiate, right? So you write the same paper on the same day, the same difficulty, right? Of all the four colleges. Initially it was different, but now it's the same exam, right? So that's what is meant by intercollegiate. So you have to be very vigilant. You have to keep checking the websites of these royal colleges, and keep an eye out for the exam dates. So they will announce part A slots have been opened, dates for the part A exams, international has opened. So those are the notifications that you need to be looking out for. Uh, then uh, I will. It's difficult to incorporate the study materials and your study pattern and how exactly you should go about the planning for the exam in in one video itself. So if you guys want me to highlight the study materials to use and how exactly to go about your preparation, do mention in the comment section below. I will definitely make a separate video where I'll highlight all of those things. Now, yeah, that's about part A. And coming to the payment and registration. So once you keep checking the website, let's say they announce that the part A dates for this January term is out. So what you do is you have to create an account on that Royal College website. It will have your basic details, so you put all that, your contact number, your email address, and a lot of information about your nationality and your background, qualification, and everything. So you create your account. After that, you click onto the button which says register for the exam, and then it is going to ask you a few more questions. So you will fill all of those, and the only thing that you need to upload is your basic medical degree, which is attested by the head of the institute or the dean of the institute. Okay, so you should have this ready before you start this online procedure. Okay, remember that you have a medical degree, copy of a medical degree attested by the head of the institute. Okay, so when I give the exam, I just scanned the document and I uploaded it, and I emailed it to the medical college. But there are some who physically posted the certificate, that tested certificate also. So I know them too. It takes around 15 days for the post to reach. So you can choose to use any of these methods, because I did not have any trouble by just scanning and uploading it. The Royal College did reply back once they got my details and the application. So that's that. It's not necessary that you have to post it. Okay, depends on you. And if you're posting it, make sure you do it a little early so that it takes a transit time of 14 to 20 days for the post to reach them. So that's important. And once you upload all of this, and at the end of this application process, you will have the payment page, so which will ask for the examination, the amount, the fees that you have to pay. Usually it is around 560 pounds. That would be the amount. And make sure you have an international debit or a credit card before you do the procedure. Okay, check whether it's a Visa card with international debit possible or not. Now with this, once you finish you submit all your important the documents, you've paid the fees, then you get an immediate email from the university, from the from the Royal College, which says that you have submitted it. Okay, whether it is approved or not, they won't have mentioned. So you wait for another 1 or 2 weeks. When the Royal College goes through your application, they check your medical, the primary medical degree certificate, and they're going to make sure from the account section that the money has been credited. Then you get an email from the Royal College saying your application has been approved. Okay, so just by paying does not mean you have been approved. Okay, you got to wait for a few days, and let's say it's been 15 days, 20 days, and you haven't heard from them. You can always email them, send them queries saying, okay, this is my student ID. You usually get a student ID when you make the payment and so on, and you create an account. Tell them that you have made the payment and you want to know the status of your application. So they are more than happy to reply back, and they will tell you as to what is the status of your application. So once you get the status saying it is approved, only then you can be sure that your examination has been booked. So 10 days prior to your uh, exam date, there's an organization called Pearson View who conducts these examinations online, because it is going to be a computer based exam. Okay, live computer based exam. So the Pearson View is going to open up the platform where you can choose your examination center. So I suggest that the moment you get the Pearson View email saying choose your examination center, you open it and you immediately choose the center which is closest to you. Because the longer you wait, okay, the centers are gone. Okay, there are so many students. See, because all the exams, the exam of Royal College of Edinburgh, England, Ireland, Glasgow, everything happens on a single day, and it's going to be a similar paper, similar difficulty. And in the center, this person who's sitting next to you might be a person who's writing from Royal College of England, and you might be writing from Edinburgh. So it's the same. It's like the same center. Okay. Hence, and it's very easy to just lose out on your center. You might have to just travel a lot of distance just to write the exam. When the center was available, you did not choose it, and then you'll regret saying, "Arey yaar, mujhe center nahi mila," and now you have to travel to a different part of the city, or not part of city, different part of the country rather. Okay, because I have heard of people's stories and I've seen people do that. In fact, okay, they did not book it right away when it was available, and then they had to go to a different state, different part of this country altogether. So it's important that you be clear, and then mark your rather book your city as soon as possible, the exam center as soon as possible. So once you've done that, you will be preparing for the exam. So about the resources and books and what all to study, how much time to dedicate, I told you I cannot make it in this video. If you need help regarding that, do let me know. Okay, so now it's, let's say, your exam date and you have to go to the center. You don't get a hall ticket, you don't have any such document. You just have to carry your ID card. Okay, it could be your passport. Just carry your passport, and sometimes an Aadhaar card is also sufficient. So just carry two things: your Aadhaar card and your passport. So these are two things you have to take. Then you go. So part A again has two papers. The first paper is going to be for 3 hours, 180 questions. Then you get a 20 minutes break, and then you have another paper for another 2 hours, 120 questions. Okay, so you're going to sit there for total of 5 hours. So part A is kind of uh, hard and grueling that way, because you got to sit for 5 hours. Some people don't choose to take the 20 minutes break and they sit 5 hours straight and finish the paper, but you have the choice. Sit for 3 hours. There's no choice there. You finish your basic basic and basically your applied anatomy and basic anatomy, basic sciences paper for the three hours, and then when you have the 20 minutes break, you can actually go out to the exam hall, use your phone, you can have a snack, go to the washroom, freshen up, and come back and do your next paper, which is going to be your applied paper on all your clinical uh, topics. Okay, so again, about this I cannot cover in this video. Let me know if I should. should make another video. So that's your part A. Let's say you finish your part A, you come home, you chill, and after usually 3 weeks, you get your results. Royal College is going to release the results online, so you're going to check it online. So let's say you clear the exam, then you start preparing for your part B. Your part B examination is OSCE based exam. So here there is no multiple choice questions that you had in part A. This is totally Viva, okay, OSCE based exam. So usually there will be 18 stations. So every again there are it's division. So you will have your anatomy clinical anatomy station, then you will have certain pathology stations, and then you will have your clinical skill stations, communication station. So it will be divided like this, 18 stations, including a rest station in between. Again, this preparation, you will have to be more practical when you prepare for this. It's better you have a study partner or go take a hands-on course as well as an adjunct to your material that you have for studying. You'll have to practice communication. You'll have to have a study partner who tells you that okay, this is where you're going wrong, or rather this is what you're forgetting. You need to make this a point to include this in your history taking or in your examination, so any of that. Okay, so it's important that you have a directed study for your part B. You approximately need 3 to 4 months for this exam, okay, with a hands-on course and a study partner. Okay, that is what is recommended. So you could do without study partner also. It depends on how well you prepare. Okay, in front of the mirror. So that's also important. Now, with that, that's about the pattern. Here, the examination fees is going to be 1,049, around £1,049, somewhere around that. Now, how do you book the Part B exam? Is that see, I'll give you my example, which is pretty much straightforward. I did my Part A from Royal College of RCS Edinburgh. I applied for Part B through RCS Edinburgh itself. Because I've done from the same Royal College, they already have my basic medical degree ka jo bhi details that I had submitted during my Part A, and they also have my Part A pass result. So I did not submit anything extra when I booked my Part B. I just said I'm so and so student appearing for Part B. I just tick that thing saying book the exam, and I paid the fees. And I got an acknowledgement saying you have paid the fees and wait until we check your application status. So after I think 20 days, I got an email saying your application status is approved. So that's it. That is as simple as that. But if you appeared for Part A from RCS Edinburgh, now you wish to appear Part B from England, let's say dates are available for England, RCS England, you could do so. But the only thing is, because England does not have your details, you'll have to once again, send your medical degree. You'll have to give an attested copy of your MBBS degree along with your Part A pass certificate that is being given by the RCS Edinburgh. So this applies for any of the other RCS basically. If you're applying to a different one, you have to resubmit your documents. Now, somebody can ask me, I want to be a member of, let's say, Royal College of Edinburgh. Okay, but dates are not available for Part B. Only England dates are available. So people think that if you write the Part B exam, you become member of that Royal College. It's not like that. That's why it is intercollegiate. You can still appear for the Part B from RCS England, okay, clear the exam, and then pay the membership fees for RCS Edinburgh and become member of RCS Edinburgh. Okay, so there is no strict rule. Okay, you can apply for you can appear for Part A from any of the Royal Colleges, appear and clear Part B from any of the medical Royal Colleges, and then ultimately the Royal College to whom you pay the membership fee, only that name you can use in your title. Okay, you can become a Royal College member of Royal College of Surgeons of Edinburgh when you pay their fees. So we have to pay around I think £200. That's how much I think I paid for during my membership procedure. I don't quite remember well. And you have to pay an yearly membership fees to use the title. okay, of around £100 every year. So to keep using the title, okay. And sometimes you see many of them use MRCS Edinburgh, comma MRCS England, comma MRCS Glasgow. How come have they written the same exam for 3 4 times? No, they have just paid the membership fees of those many colleges and they're able to use the title those many times. Okay, that's what it is, because this is a very big misconception. Okay, I hope that myth is busted. And then after writing your part B, again you wait for, usually part B results take like a little longer than part A results. You wait for like up to 3 to 4 weeks, then your results come. If you have cleared the part B, then you can apply for the membership, as I just said, from whichever college. If you're applying for membership with the same college, again, as I said, you need not submit any of the details because they already have it. It's very easy for them. But if you are wanting to get the membership of another Royal College, then you have to submit all of this and say that you are willing to be a member of that Royal College of Surgeons. Okay, that's as simple as this. Okay, now with that, I just want to add one more important point is the NMC update. According to the NMC, it recognizes MRCS England, okay, as a surgical degree with which, rather surgical title with which you can practice surgery in India, even with just MBBS. If you're MBBS and MRCS England, you can practice surgery in India. Okay, that means if you don't have MS, don't have Master of Surgery, which is an essential criteria to practice general surgery as a specialty, like if you want to practice that, MS is necessary. But if you have MRCS Edinburgh, the NMC approves it as a valid qualification and you can go ahead and practice uh, general surgery in India. Okay, and after all this, you do your OET, okay, or IELTS, whichever you find easy or comfortable, and then you apply for the GMC registration. Okay, so I think these were some of the frequently asked questions that I would get, and I think I have gone through each one of them and highlighted the important points. As I said, the study materials, resources, how to go about the study, how to plan your study, all of this will be incorporated in another video. If you want me to do that, just do let me know. This video was just to make you familiar regarding the exam, what exactly it is, and the pattern, and how to go about it. Okay, um, that's it. I guess it was useful, and do let me know your views and questions. If you have more questions for me, please let me know in the comment section below. And follow us on Learn Synapse. That's our Instagram handle, and you can contact me. You can DM us, and regarding any of the help that you want during or through your MRCS journey, we are here to help you with whatever experience we have. Okay, so I hope you find this useful and have a good day. Bye bye.